Hey guys, Dr. Don here for the Wellness Way, South Jordan. So I love all of these comments that we're getting on the last few videos. All right, so a couple things I have to address on this video that this amazing PCOS educator, I hope she helps a lot of women with PCOS. PCOS is the #1 cause of infertility in our country. Polycystic ovarian syndrome is most commonly driven by insulin resistance. Typically, the #1 treatment is metformin. Okay, metformin does absolutely nothing to fix the cause of the insulin resistance that you developed in the first place, if that is what is causing your PCOS. There is other causes, that's just being the #1 cause. So the first thing that I want to address is the fact that she said that I say that hormones aren't real. Not sure where she got that. Again, she just, she's not listening to the video. She just wants to be angry at me because I'm a male, because I called her a female. I'm sorry for offending you ladies, you women out there, that because I called you a female. A lot of you guys are having a problem with that. I'm sorry. You are a female. I'm a male. So she attacks me and says that I say hormones aren't real. What I was explaining is that all of your hormones are not being tested. See, the three main hormones, when you come in with infertility, you come in with PCOS, you come in with endometriosis, you have extremely painful symptoms when it comes to your cycle. Your cycle's all over the place. You skip months. You have amenorrhea. You're not even having a cycle. The three main hormones that are checked is progesterone, testosterone, and estradiol. See, if your doctor's telling you that you're getting your estrogen checked, they have no clue about hormones. There's no such thing as estrogen. Estrogen is a word that describes many different estrogens. Okay, the three main estrogens that need to be checked and can be checked through blood is estradiol, estrone, and estriol. See, estradiol is the main hormone produced by the ovaries, but within the liver, it's converted to the other estrogens. Now, those estrogens, after they have action on your tissue, they then need to be detoxed out of your body. And so through a Dutch test, it's done through urine. This is how you can look at the four main metabolites of those estrogens. Now, why is that important? Well, it's important because depending on what metabolites or what detox pathways you're detoxing down, it can set you up for cancer. 4-hydroxyestrone is a metabolite of estradiol and estrone. And with other inflammatory processes going on in the body, you're more likely to detox those estrogens down into 4-hydroxyestrone. If it binds to the DNA, it'll cause DNA and it will drive estrogen dominant cancers. Are they checking those metabolites in your cases? Even if you're on hormone replacement, are they checking those metabolites, which is even more important? And the answer is no. I'm not here selling testing. Our offices make no money off of testing. That's why a Dutch test through us is actually $100 cheaper than going through Precision Analytical, going directly through. Why? Because here at the Wellness Way, because we have 50 plus clinics around the country, we have negotiated better prices for our patients. We don't make any money on testing. I'm not here to sell testing. I'm also not here to sell supplements. That's another thing that I get attacked about. Watch my videos. I don't talk about supplements. What supplement did I talk about in that video? I actually said that lifestyle changes is what makes a big difference. Now, are there things like white peony that can drive testosterone down into estrogen? Are there different methyl groups like folate and B vitamins and organ meats and DIM complex and MSM? Is there different things to help to feed those estrogens down those healthy detox pathways? Are there herbs that help with liver function to improve methylation from hormone to hormone? Is there things like Japanese knotweed that can block that inflammatory pathway into 4-hydroxyestrone so that if you are at a high risk of developing cancer, we can immediately get you on an herb that's going to reduce those metabolites? So do I use herbs in the office? Well, of course we do. Herbs have been studied for thousands of years, guys. Most medications are made based off of the actions that herbs have. PCOS educator, you better be telling your patients that they need to immediately cut sugar out of their diet. I know most of your patients with PCOS are females or women or ladies, whatever you are okay with me calling them, okay? They need to cut sugar out of their diet. If they're still eating sugar and they're taking metformin, PCOS is not going to go away. This is why most of you PCOS educators say once you have PCOS, it will never go away. Guys, here at the Wellness Way, we have a completely different perspective. I am okay to continue to be attacked personally because I know I help hundreds and hundreds of women a year regulate their hormones naturally. The Wellness Way helps thousands and thousands of women a year. We help with infertility. We see amazing life transformations. So you guys keep attacking me personally, but you people that want to listen, you humans, again, I don't mean to say that in a derogatory way. I'm so sorry. But if you truly want to get a good look at your hormones, if you truly want to see the whole picture of your hormones, you need to get the proper testing done.